worst today that we have seen for a while. And of course, this happened back in June when we saw the air quality so poor in New York City and some of the pictures that came out of that. And now we're facing it here. And Brian Sherman joined me a little bit earlier talking about the weather pattern and why exactly that is happening, and then how it can move out of the way. You're looking at live pictures. That's in Romulus. That's Metro Airport. You can kind of make out the tower. But the most important thing that we're talking about is this is hazardous to your health. And when you look at the air quality index, which is good, is 0 to 50, but then it can take you all the way up to hazardous, which is 301 to 500. Well, this morning we were at 306. Detroit is now down to 237 right now. But to talk a little bit about health impact, we've got two doctors who are joining us. Dr. Ruma Shrivastava, she is a pediatric pulmonologist at Children's Hospital, and Dr. Renee Matthews, she's an asthma and allergy specialist. And thanks to both of you doctors for joining us right now, because I think when we talk about people who are compromised, number one, we know that the breathing issues are there. But then number two, generally, when we're talking about our younger people who are out and about and maybe running around at camp today, what they should be looking for. So Dr. Shrivastava, let me start with you in terms of talking about kids across the board in general, our younger people, what we should be looking out for as parents.
Yes, so unfortunately, children are more susceptible. We know that they're more susceptible to airway pollutants and irritants, because they have smaller airways, they have immature, metabolic and detoxification systems, and also just because they spend so much time outside, playing, which is normally a good thing, but not so much right now. So yeah, children are definitely more at risk to these air pollutants, and particularly children who have underlying lung conditions such as asthma, cystic fibrosis, chronic lung disease due to being born premature, or basically having any kind of chronic health condition, chronic lung disease.
And Dr. Matthews, this goes right to you then. What is, I guess, the discomfort factor when we talk about elderly people or people who are dealing with asthma and with allergies with this kind of air quality?
So unfortunately, like Dr. Ruma said, same thing. The most vulnerable populations, as the elderly, also pregnant women are in that population as well. When it comes to this type of pollutants, you can see all sorts of symptoms that would make you kind of alert to the fact that maybe you are being affected, because it's not something you can see so clearly. You might feel it before you see it. So you might have nausea, headaches, shortness of breath, wheezing or whistling sound when you breathe, dizziness, and there's something else I'm forgetting for some reason here. Coughing, of course, and it's not the light dry cough, but coughing and coughing and coughing and can't stop. So these are things that our elderly population, pregnant women, and people, of course, with lung conditions should be definitely looking out for.
So is that something then that we should immediately go to an urgent care or an ER? Is it something about getting yourself into an air-conditioned room? Or how would you tell people then to proceed if they do feel some of those symptoms?
I feel like if they don't go away, then definitely you should probably go to urgent care, give your doctor a call. But definitely remove yourself from the situation if at all possible. Stay indoors, wear a mask if you must go outside. And as Jim had also mentioned, make sure when you turn on your air conditioner in your car, it's on the recirculation mode, but make sure that you have HEPA filters, the high efficiency particulate air filters in your home. That will help to get rid of any particles that are in the air that happen to come into your house. Make sure when you come inside, you wash your clothes and take them off, because those particles will remain on your clothes. And then, of course, N95 or KN95 masks.
Dr. Shrivastava, I mean, as we go forward, because I can only imagine that this is something that we are going to be dealing with for the rest of the summer, how would you tell us all to what either to watch for or how to proceed?
Yeah, so, unfortunately it's summer, all the kids are on break and they're in summer camp, so it is somewhat bad timing. But yeah, unfortunately, as Dr. Renee said, the best thing is to stay indoors. If you have to go outdoors, try to avoid strenuous activity. For the patients with asthma, I would reiterate that it is extremely important, even more important than before, to stay adherent to your medications and always keep your rescue inhaler handy, in case you need it for increased cough, shortness of breath, or wheezing. But this is not the time to kind of take a break from your controller medications from asthma, because this is the time you really need to be on them.
This is a lot of great information. Dr. Rumi Shrivastava, a pediatric pulmonologist at Children's, and Dr. Renee Matthews, of course.
Live pictures of the Detroit skyline. Our Windsor sky cam